We're talking health tips and specifically trending topics that have been in the news lately. There is a new study led by researchers at the American Cancer Society that indicates that cancer rates are rising for millennials and those in the Generation X age group. This study found that younger generations are more likely to be diagnosed with 17 different types of cancers. Those include colorectal, pancreatic, and kidney cancers. Researchers believe that this could be due to a variety of factors such as obesity and an increase in sedentary behavior. Catholic Health's Chairman of Cancer Services, Dr. Bhoomi Mehrotra, shares his thoughts on the findings.
We are learning in cancer biology that cancer formation growth has that interplay between the genes that we are born with and the environmental exposures that we are exposed to. Now, are those just in early life that we've been exposed to certain carcinogens that lead to cancer formation? Were they certain lifestyle habits? Were they our sedentary nature, change in diet, which has ultra-processed foods? Was it related to obesity, which is the consequences of all the others? And we know there is a clear link between obesity and some of these cancers, such as pancreas cancer, gastric cancer, uterine cancer, ovarian cancer, where it is very important that lifestyle changes will make a difference.
And according to the Centers for Disease Control and Prevention, there is promising news regarding the mental health of teenagers, specifically girls. The CDC survey found the percentage of teenage girls who expressed feelings of sadness or hopelessness has decreased since 2021. This is extremely positive news as depression levels for all teens heightened during the pandemic, but experts say there is still plenty of work to be done.
The results were very interesting from the point of view that we've seen a decrease in suicidality and depression in that population. But let's not get too optimistic about it because unfortunately the N is very small in terms of the improvement. So we have an improvement of about 4% in depression and about 3% in suicidal serious behavior. So I think although there is room to be optimistic, we need to be cautious about what the results have shown.
Now, thanks, Tim. I find all of it very interesting. In the last segment here, we talked about mental health being affected by the pandemic. But I was wondering, the first segment, though, about physical health, was that not also because patterns were developed then, eating habits and all kinds of healthy habits? Are we seeing the pandemic had an effect on physical health on teens today?
As far as physical health, I think the pandemic and what Dr. Brenner said specifically is why you're seeing that decrease is because I think the pandemic brought forth an awareness of mental health increases and also the opportunity to provide different treatment options that weren't necessarily available or as prevalent, such as telehealth. You can do a lot of video visits now that can increase both the mental health conversation, and through those conversations you can help things like physical health through eating, lifestyle changes as well.
I would think that young people would be more interested in their physical health, but I guess it's a challenge even for them too, right, to develop healthy habits for young people?
I think, and again, just going back to the pandemic, you're talking about a lot of lifestyle changes that happened, a lot of things where they had active lifestyles and they were halted and paused. So yes, I think just talking about it and coming up with different solutions and kind of getting back into those routines, that really helped out a lot.
Well, Tim, thanks for stopping by, and thanks to all the work that Catholic Health is doing to be preventative too. I mean, it's not always just about fixing the problem. So thanks for bringing the good news to us.
My pleasure, and thank you, Father Gerard.